just in here like, oh my God, what the?
I didn't say anything that I really
yeah,
don't
okay.
care for
I
people,
know.
you know.
7-Eleven, let's go to the KWM new Zoom room where Dr. Hoa Nguyen is standing by. Doc, are you posing or are you frozen?
Oh
Okay,
no,
good. Yeah.
I'm still
He's
moving.
flexing. He's just pretending not to hear all that. So. Good morning, Doc.
How was your meeting?
Good morning, guys.
Good morning. How was your meeting? Short, long
Oh,
meeting?
the meeting very good. I mean, we talk quite a few things, but just to update you guys for a few things we talked about last night. You know,
Okay. Uh-oh. You're freezing.
the the new travel quarantine. We pretty much set except that we you got him hear me?
Yes, we can hear you now. You said you guys talked about
Chris,
quarantine?
Sabrina,
We can
Yes,
hear you. Yeah,
you
keep
talked
on,
about
Doc. Go ahead.
quarantine?
hello.
Hello.
Okay, yeah.
Can you hear
We
us now,
talked
Doc?
about the
Okay.
new Q factor. Yes, So we gonna try to roll out the 7 days testing out the Q factor. And basically, they're going to have the one of the program called Sarah Alert to be ready. Once that's ready, um, we're going to roll it out. Right now, to make sure that the Sarah Alert have all the insurance and the legality of it to be in place, and then we're going to roll it out. But everyone kind of agree that's that's the best program we can roll out. Finish what it's doing, we can roll out the Q factor testing out 7 days along to Sarah Alert. Okay, so um, uh, we asked them to kind of fast pace that, so hopefully in the next can go home earlier. Okay, so right now it's still the 14 days until that new program coming out.
Doc, let me ask you because I got a friend who's
Everyone on board
right.
at this time.
Doc, what if
Chris, go
someone
ahead,
is?
Chris.
Oh, wow, this is a really bad connection. Yeah. Doc, what if someone's traveling into Guam with a 2-year-old child? What are the quarantine protocols in that type of situation? You want to try and boot him and then get him back on?
No.
Someone come in, the whole family would be quarantined a Q factor.
Okay.
Because there's
no exceptions. So I guess the way we understand it,
Right.
and just reading through the guidelines, is that there are no exceptions to the 14-day government quarantine when it comes to travelers, except I guess if you're a medical professional, right?
right. I mean, if you're a medical professional, then you can quarantine at home because you consider essential to the community. But everyone else is going to be in the Q factor if for full 14 days. That doesn't matter what your age is.
Was there something,
So
Chris, that you heard, or?
No, I didn't hear anything. I just wanted to clarify because I just know somebody who's traveling with a young child, so I wanted to just check if there's any difference in the protocols.
no, Chris, it's the same. Even for minor now, if you travel, minor can travel themselves, but now because some minor turned positive for the COVID, they actually have one of the parents take the minor Q factor, so they cannot take the minor home.
I see.
And so
Yeah, so that
So when we talked last week, you said the Sarah Alert, it's going to be mandatory for people to download the Sarah Alert in order to be, excuse me, for the 7-day test out, right? And that's still in place whenever you roll this out.
Yeah, that's still go.
Okay.
I mean, right now, I think the Sarah Alert on the legal side of the house to be clear, and then once it's clear, we will roll out the program. But we don't want to send people home after 7 days testing out without any type of monitoring of their symptom at home for the next 7 days. So that thing you have to sign in like 2 or 3 times a day, report your symptom. So it's very good. It's we all pretty much agree that that had to be a must to have. And then you can refuse. You refuse, you stay in the Q factor for 14 days. That's some program they do. Saipan do the same, and look like the program working out very well. So we just need to get on board and get that program together.
Saipan has a Sarah alert?
Saipan use Sarah alert, and there's some people when you go there, you have to use that for the next 14 days when you arrive. So
wow, Doc, I gotta ask. So I mean, I'm sure you guys discussed like the CNMI and how they are faring with COVID-19. Does that topic ever come up in these PAG meetings where people are like, God, can we just get the CNMI's playbook, or is it just entirely? Do you believe it's just entirely different circumstances with their political status and what they're able to do that we aren't?
We talk about them all the time. I mean, they somewhat much more. I think conservative they actually test you when you get there, and then they test you day 5 on the testing out, and then they put the Sarah alert, so you have to use it while you're there. So I mean, it's the same concept that we tried before, that we kind to have people home quarantine, but that don't work very well. So now that we go in reverse direction, we're gonna quarantine them for the first 7 days, test them out, and then do the Sarah alert. And again, if it worked well, we see the compliance rate is good, we can roll down to 5 days. But that's a thought. No, in the future, the 7 days working out well.
Mm-hmm. So you get the Sarah alert, and you test negative. You get the Sarah alert. You're out on home quarantine for what a remainder of 7 days for a total of 14.
7 days.
Right. So what do you do when you're done with the 14 days? You just get rid of the Sarah alert on the phone, or what?
Yeah, you can get the Sarah alert off
Okay.
them, and you're done. It's a web based, so
Right.
you can release from your home quarantine.
How
so you'll be fine.
soon? How soon did you say we're trying to get this done?
We asked them 1 to 2 weeks because they really have the fast pace. I mean, the quarantine team are working on it. Like I say, it's on the legal side. We say, well, can you not drag your feet and really roll this out really quick? Because, the Q factor for 14 days kind of long, and we need to kind of let people go home early. So we ask them fast pace, so we're going to ask them again every meeting. So we do Tuesday and Thursday. So every meeting, we're going to keep harping on that one.
AG legal side you're talking about, or governor's office legal side?
I think they have to do some type of insurance. I don't know. That's too much information that I want to find out. But I know they have to get some insurance for that, all that kind of stuff. So, like I said, we ask them really fast pace because we really need to move.
Who else? I mean, not who else. What else did you guys talk about last night?
Okay, so the other one is that the new app for Guam, right? It's going to roll out sometime on this week, Thursday or something. Guam COVID-19. Yeah. That one is pretty interesting. So if you guys don't hear about it, then it's on GVB and on the media and everything. But that's something that people voluntarily download to their phone, so they kind of monitor you. If I'm a company employer, I would download all my employee on it. Just because that help with the contact tracing, right? Mm-hmm. I mean, if your phone talk to each other, even you don't like it or not, when you recognize you sit next to someone, and if you sit next to someone that's positive for 15 minutes and 6 feet, within 6 feet, if that person turned positive and public health download the program, it will notify you if you did come in contact with someone that COVID positive, and tell you what to do and when to test, all that kind of stuff. So it cut down the contact tracing a whole bunch, and it helped a whole lot. So if I'm a company, I would probably pretty much interested in that, just because it tell you, hey, this person is positive working in your office, and you that close to that person for 15 minutes, maybe you want to get tested. So rather than test the whole company, so that's something that is very helpful. I would encourage people, especially company, to download on the employee phone, just to make sure that you protect your company. But I think it's rolled out on the on Thursday or Friday.
Yeah, there's supposed to be a press
I believe.
conference tomorrow. Janella Carrera was on our show yesterday. She couldn't
Yeah.
really speak a whole lot about it because
Yeah.
the credit has to go to Adelaide.
Oh, that was crazy.
So just
That was crazy.
yeah.
I'm sorry. I just got to say that was like, Doc, we all know about this app. And Janella was like, oh, I can't talk about it because the governor is going to announce it. Like, dude, we all know about it. We're talking about it a
We
million
all
times.
know about it.
Come on.
This is
Yeah.
Oh,
okay
you're
to
not
talk
at
about it.
Adeloop anymore, girl. Come on.
No,
Yeah,
it's a good
where did this
program,
app come
and
from though? I mean, who developed it? Did we hire somebody
I
to do
think
this or
it's Google and Apple have this one. It's just free. It didn't
Okay.
cost us anything.
Okay, that's good.
And I think we are the first place on earth to use this thing. So, they want to give us for free, and it's very good to help the tracing of the positive contact. So I would say that there's nothing secret about it, and so it's very good. It didn't cost you anything.
Good.
So I would say that if I tell you, all my clinic staff probably will be on it. Just because that way we can find out if anyone really have a close contact with a positive COVID patient. So it's interesting. So I guess, like you say, they're going to roll out a brief conference on Thursday, and
Right.
hopefully they'll be out by this week or next week.
Doc,
And it's voluntary. You don't have to do it.
was there any discussion at all about the end of the PCOR 1 lockdown and an extension or anything?
Sabrina, that's really up to the hospital. They have 53 patients in there and 11 on the vent and a 14 ICU level. So it's very tight in the hospital. So PCOR 1 is really depend on that one. I think that anything else, be PCOR 1 plus some relax or some restriction, but I don't think we're going to get out PCOR 1 until the hospital kind of slow down a little bit. The one that we really like people to help is that the high risk patient, especially the dialysis patient, guys. I mean, we had to pass the word out there, and you have a family member that on dialysis, you have to do everything you can to protect that family member. Dialysis patient does not do well in the hospital. They got COVID-19, and like it or not, if they have COVID-19, they will be at GMH for the full 14 days on dialysis. That's a long way to sit in the hospital. You cannot go home. So you really need to protect the very high risk patient. Like I say, those patients does not do well with the COVID-19, and most likely you might lose the family member. So it's very important, especially with the young population from 20 to 40. If you have a family member that have dialysis in the family member, then just don't even come close to them. Protect them at own cost.
Doc-
And that's what we ask them. Because 14 days in the hospital yourself is a long time.
Doc, can I ask then, you said 50 hospitalizations over at GMH alone, right? Are a majority of those that are at GMH, do they have comorbidities, or are a majority of them just COVID, period?
They're all, most of them have comorbidity. Sabrina, one of the comorbidity that is very clearly a high risk for complication of COVID-19 is obesity, right? I mean, if you're overweight, you already have a plus on your chart already for comorbidity. Even you don't have high blood pressure, diabetes, anything. Overweight is one of the risk factor on that put patient with COVID-19 at risk. So yes, most of the people, at GMH, they have some type of comorbidity. But again, if they have it and they're well controlled, this thing can turn on you really quick. I talked to Dr. Agon last time, and people can give you a thumbs up and say they do well, and about 2 or 3 hours later, they down. So it's really can attack your lung very quick, and we really have to take this thing very serious. You can smile, put your thumbs up, and a few hours later, you're done. So it's really, it can turn around the corner here really, really quick. So we really have to be serious on on this virus. We always think it doesn't happen to us, but yes, it can. It happens to anybody. So we gotta be careful.
Has there been some sort of a change? Because I know that it was GMH is supposed to be the COVID hospital and GRMC is supposed to be the non-COVID hospital. But when you look at the breakdown for the hospitalizations, it says that there are COVID patients hospitalized at GRMC. Oh,
GMC.
yeah.
Why is this? Is it based on you have the capacity to handle them or not? If GMH are on full,
Okay.
then you can't transfer the patient. Because the patient show up in the emergency room on either hospital, including the neighbor hospital. But if you don't have the bed to transfer over, you're stuck with the patient.
So that's
what's going on, right?
Saying. Okay.
Okay.
Yeah, and it's a bed capacity. It's a nursing staff capacity, right? I mean, GMH did lose some nursing staff with an infection. I know.
Right.
I understand that some of them come back already. Okay, and there's some FEMA, some federal nursing staff and physician there to help them. Again, you kind of nursing staff, kind of capacity wise. So once you max out at 53, you really be very careful in accepting any more, COVID patient. If they show up in the emergency room, you're stuck. You can't move them. But if they show up at GMC, then GMC will stay with them until GMH have some room there.
Yeah, and I know one thing that Lillian told us yesterday. She said that we're no longer accepting ICU, right?
non-COVID ICU cases.
Yeah.
Exactly. They are 100% ICU COVID. They're max out.
Wow.
You can't put any more people in there.
I wonder how much of
right
it
now,
knows.
they have 14 ICU patients right now, and they max out. There's no more room left in the ICU.
Was there anything new about opening up the SNU? We just don't have enough staff.
Yeah, I saw the stat there. There's like 8 people at SNU. I'm not sure that COVID or non-COVID, but there's 8 people there somehow.
Wait,
so they are,
8 people.
They say SNU. So I think if Lillian coming after this, she can answer you. But I saw the stat that SNU say 8. So I think they're a patient there, I think.
Oh, was that on the sit rep? We'll check. Well, we got public health coming up next week.
The sit rep on that one. Oh. I think they open already. But right now, beside the COVID patient, primary care physician outside really step up and do their job too, because there's a whole bunch of non-COVID related patients in the hospital too. So people are staying home. They eat and they don't exercise, and they get in trouble. So as an outpatient, the primary care physician have a very important job to keep their patient out of the hospital. So it's hard. So we got the attack on both sides here. So people just have to be careful. That's why I say exercise is the key. You got to exercise somehow.
Yeah.
Okay.
All right.
The other one, Jace, is the company now, you can see the port, right? They stand up their own tracing, contact tracing team, and it helped a whole lot. I talked to the director yesterday, and big company, if they want to step up and do their own contact and tracing, public health can train their employee to do that. It really helps. It's something that private-public partnership, and that really help public health and do the contact tracing. Right now, as you hear, they're like 4 days behind, which is really too late. They're supposed to be 1 or 2 days. So if the private company want to minimize the work loss of their employee, then they can step up and form their own tracing team. Like I said, public health are willing to train them. So that's one thing that there's a program, to UCSF program that came in last week. It's very nice. One of my chief nurse went to there, and very simple to learn, and you can form your own team.
Oh, that sounds cool. We can get T-shirts. KUAM contact tracers.
It's
hey, who were you with last
really
night?
Nice. Huh?
No, we're just joking. Doc, is there anything in closing? Because we do have public health, and we want to get over to them and look at the public health side of this.
Yeah, they do a very good job. And you see yesterday, there's 43, right? But 37 of them are contact tracing. So kudos on them and track those patients. You know, that's a big help. 37 out of 43. So they are doing some work.
Wow.
A lot of work there. So thank you for them for doing that. Again, the real message for the people in Guam is that, you know, wear your mask, you know, wash your hands, social distance. And if you have a high comorbidity, like patient with dialysis in your family, no, please we'll take good care of them because we don't want to lose them. So we ask for your help. Okay.
All right.
Thank you, Doc.
Thanks a lot, Doc.
Okay, guys, don't work too hard. Okay, have a good day.
Too late. There goes the sweat right there. Oh man.
Okay.
Thanks, Doc. Appreciate it.
Okay, be safe.
You too.
Chris.
Yes.
Next show, I will be with Dr. Agan.
Nice.
Awesome.
Okay,
All
so
right.
we'll do it tomorrow.
Okay.
Okay.
She agreed already. Okay.
Okay,
On
so-
Thursday. Okay. Okay. Bye.
Okay.
Thank
Yeah.
you.
Thank you, Doc. Right on.
I didn't see anything on SNU.
I don't know. Well, let's just keep it.